Hello, world. Good morning, good afternoon, good evening, wherever you are in this fast forward planet, which is in flux in a powerful way because of a jolt from a virus that no one really knew about until it just seems like yesterday. And it seems like 1,000 years ago at the same time. Somewhere around November, biology jumped the tracks, and we're reeling from that still. And the news cycle doesn't keep up with these kinds of phenomena very well. So what we're trying to do is get behind that nonstop flood of headlines that can blur you out completely. And I've got some wonderful guests who meet every Friday, with some special guests coming today as well, who can take you behind the headlines and the hashtags and lead you to some sanity and a sense of where we go from here. And so if you've been here before, you know this crew, but I'll just quickly say Wendy Wertheimer is a decades-long veteran of both the National Institutes of Health and the World Health Organization, dealing with epidemic risk since the AIDS era. John Cohen, a multi-decadal journalist at Science Magazine, focusing on these issues, and sequestered near a beach in California.
Yeah, really.
Yeah, I know. Bob Bazell, more than 3 decades at NBC News, and now still exploring these questions as frequently as he can. Science correspondent who also has been at this since the AIDS age. And Laurie Garrett, Pulitzer winner for her early work on Ebola, and who's been dealing with, as a journalist and increasingly as a smart policy person, engaged as she was for a while at the Council on Foreign Relations, and as she is now at MSNBC, with giving people a clearer view, again, beyond the hype and to the actual horror of what's happening as well. If you could all mute your microphones when you're not speaking, that'd be great. I do hear a little bit of feedback. So, but let's get going. It's an insane time. Each week seems to have a different flavor of insanity. Laurie, maybe you want to start off with what's on your list of things that you saw that really excited you in a way journalistically, and then what's really driving you crazy.
On the science front, I was really intrigued by the Warby paper. It's an analysis of thousands of genome sequences of the SARS-2 virus, and basically refutes all the original narratives of which original entries of virus on both the East Coast and West Coast of the United States and in Southern Europe were the ones that took hold and resulted in the current pandemic spread, and argues that, in fact, the very first entries didn't go anywhere. They sort of had a short stream of contagion, and then, that was the end of it. And that actually for the United States and for Europe, the biggest entries, arrival of virus, all occurred after announcements, after they were fully aware of the existence of this new virus, and after they'd taken lockdown measures of one kind or another, or in the case of the United States, had done a travel ban. And so it kind of belies the whole claim by the Trump administration that, he saved us from this terrible outcome by virtue of travel bans against Wuhan and China. It actually shows that after the travel bans were in place, that's when the entries occurred that have resulted in now this is a preprint, so as per our conversations in the past, it hasn't yet been thoroughly peer reviewed. Something could go amiss, but it's quite striking. They show a kind of circular look at the whole world and this constant global spread of 2 dominant forms of the virus traveling around the world.
So that shows you, so that illustrates how the digging in on the science can actually really clarify some of these murky questions pretty quickly. The science really matters still, the basics here, doing that kind of analysis.
It also shows you the science is always evolving because, just 2 weeks ago, we were looking at another preprint that came out of Los Alamos that said there was one form of virus and it has sort of been dying out and being replaced by another form of the virus without any real sort of, as we say, phenotypic association but a sort of hint that maybe that explained why one side of our country had a worse epidemic than the other side of our country based on which form dominated and so on. And this paper really kind of throws that whole thing out the window. And I think maybe that's the jumping off point lesson here, is that, we've said this before in our past discussions, we have to constantly be willing to rewrite the science, to rethink it, because we're in the middle of a rapidly evolving narrative. And what seems absolutely irrevocably true on Monday might be completely reversed by Friday. And I mean, John did one of the, on this story of when and where did all this start, John did one of the important papers early on, because the narrative at that moment, which was pushed by China and WHO, was that it all came out of the wet market in Wuhan. Right. And as long as they shut the wet market down, everything was going to be A-okay. And John did a very important paper that showed, you know what? Most of the early cases weren't in the wet market. They didn't have any connection. Right, John?
Yeah, that was January 26th that I did that story. And, at that moment, we had just learned that there was human-to-human transmission from China 6 days earlier. So the wet market thesis was in question. And then there was a paper published showing that 4 of the 5 earliest cases had no link to the market. And, and that point, you're exactly right. I mean, the evolution in thinking, there's resistance at first to new information, right? No, it can't be. And then it turns into, well, maybe it is. And then it turns into, well, we knew that all along. And, and that's the traditional evolution of scientific thought. And I think Laurie's highlighting a study this week by a really respected researcher, a forensic virologist, Michael Warby, who has done this for influenza and HIV. And what he's uncovered here is extremely compelling. And it's probably accurate that this did take off later than the common narrative. And I think it does force us to rethink our mistakes. And I interviewed Yiming Xiao, this appeared last Friday, who's a chief AIDS expert for the China CDC. And he said to me, as much as people criticize China, okay, we made mistakes in the first few weeks, but I don't understand the mistakes you've made that went on for months. He said, maybe we made mistakes for 3 weeks, but look what you did. And
I want to jump on that, because I just had the pleasure of getting a very detailed rundown on what South Korea did. And, when you really listen carefully, blow by blow by blow, to how South Korea responded to entry of COVID into their country, I mean, you have to be so embarrassed as an American. The difference is just night and day. They mobilized the entire nation. They had contact tracing from day one. And then subsequent micro outbursts that have occurred, they haven't just contact traced. They can tell you who was seated 5 feet from the singer at a karaoke bar when the karaoke bar singer turned out to have the virus. They can tell you where everybody in the whole karaoke bar was seated and what the likelihood was that this many inches away from the singer, they got infected, and this many and this many. I mean, we don't have anything like that going on in the United States. We haven't coupled serious epidemiology with control of this virus at all.
Well, that's a good point. Can I bring in Wendy on that too? But anyway, what are you going to say, John?
I just want to point out something very quickly. Yeah. Right out my window, there's a construction crew. No one's wearing masks. There are 2 guys that are almost hugging each other. I'm looking at them right now. I could point my computer screen at it. You would not see that in China or South Korea or Singapore or Hong Kong. It wouldn't be happening. And I'm watching this, and I'm watching these guys, and there have been outbreaks of clusters of construction crews. And It's happening in farm workers now all over the place. They just don't get the message.
I'm going to add right now our new friend, Bill Weir from CNN, who we'll be talking about this and also about how this relates to climate coverage in a few minutes. But Wendy, I wanted to bring this to you. This has come up in this press roundup before, but also in some of the policy sections I've done on this Sustain What broadcast, that it's one thing to point to South Korea and then another to look at the United States with our 50 states and our system that's so, you could say, so broken, but it is different. And South Korea is on a wartime footing 24/7. So it's got a responsiveness that's just unique, perhaps, and it makes it harder to do a simple A/B comparison. Wendy, you've been in that policy arena. You've dealt with Congress for decades. You did. So what is this? When you see that science picture, as Laurie's, the paper she alluded to, comes up, how does that make you respond?
Gosh, I apologize. I was frozen and missed part of Laurie's presentation. I just think that we have such high expectations of our public health officials in this country based on what we've done in the past. All I can think about right now is there are 100,000 people who've died, 100,000 people whose families have mourned alone, millions who are sick. It took 10 years for AIDS to kill 100,000 people in this country. The one thing I'm sort of focused on too is that we lost one of the great AIDS advocates a couple of days ago, Larry Kramer, and sort of what he stood for changing the way we do science and the way we do public health in this country. He really did beat down the doors of NIH, of bringing people who are affected and infected into the process we use to conduct research and bring them into medicine. And this has kind of been a theme with us, I guess, for the last month we've been doing this, but yeah. Maybe AIDS isn't a perfect framework, and maybe we made a lot of mistakes, but I also feel like we're not learning the lessons either of how to do what we need to do. And even as one of our other guests is going to talk about today, even the way we have data, that CDC's data is not complete, that certain states like Georgia are, changing the way data is presented, so it's not a true picture. So those are things that scare me about how we're facing the job in front of us. That doesn't answer your question compared to what Yiming Chow is talking about in China, but
no, I know, but this is about we have to get to more than one theme here. This week, one of the big news beats of the week was that number, 100,000.
Yeah.
And as many have reported, it's likely an underestimate, even as chunks of this country continue to circle around the idea that these data, as you say, which are hard to interpret and which luckily the COVID tracking project and others are trying to get some clarity around, the murk in there is where assertion can pounce. It's like on climate change reporting it for a long time, I kept seeing this phenomenon where an absence of evidence leads to an overabundance of assertion. And that's what we see now with social media, steroidally amplifying it all in a way that makes a very tough landscape. So Bill, I'd love to have a hello from you. And you roamed the world of several years ago and doing this amazing series that I wrote about on .earth, on rapid change, right? It was on places where things that had been in one way for thousands of years were changing profoundly. And now here you are in the middle of rapid change, and you're focused mostly on climate, but you're living amid COVID-19 too. So when you think about the media landscape right now, what comes to mind?
This to me is such the coming attractions, this COVID-19 pandemic for I think a more unpredictable world as we go forward. And ultimately for me, it all comes down to stories. We're the one animal on this planet that can tell each other stories and imagine different realities. And we're seeing that your survival rate is directly proportional to the stories you're told and what you grow up in and the politics around you and the religion around you. I just was reading this book about how the word quarantine comes from an Italian word for 40. And They didn't pick that number scientifically. That was out of the Bible. 40 was the number of cleansing. The flood was 40 days and nights. And you think, that is such ancient thinking. Well, right now, the CDC is changing the language at behest of the White House when it comes to communion cup sharing and church choir gathering. So health decisions are being made around the stories we're telling ourselves and what matters to us. And, when it comes to news, especially cable news, the equation of getting on the air is fear and immediacy. Okay? What is scaring us most right now? And I live here in Dumbo. There's a carousel, an antique carousel that's been shut down. Last time it was shut down was Superstorm Sandy, due to an invisible enemy, heat trapping gas. And the science says there's no doubt the water is going to rise here in Dumbo, Brooklyn again, but it doesn't scare us enough to stop flying and park the car. The same way as seeing a pandemic take over emergency rooms and kill people we know. And time tends to rub the edges off of fear, and so the climate crisis and now this pandemic, however long it lasts, is stretching out to the point now which sort of rips the fabric apart of societies. I cover hurricanes or sudden disasters, even 9/11. Those things tend to punch in the nose, tends to pull communities together because we're all in this, and then we start the rebuilding process. It's the slow motion droughts and famines and now tragedies like this that really, pull open the cracks in society. And you look at your neighbor and say, I wonder if he's hoarding toilet paper or food or water and those sorts of things. And you look at, when you see an officer kneeling on the neck of George Floyd, that sends people into the streets, that immediate visceral thing. But what's harder to see, and Wendy's team and research points out that African Americans are dying of COVID at a rate, I think, two times as much as the rest. That's harder to see. So it's all of these things, I think, it's incumbent on journalists to take the news of the day and contextualize them as this is not some natural disaster. These are unnatural disasters depending on human activity and decisions and wisdom going forward. And whether we flatten the curve all depends on the buy-in of our communities. Those that wait for people to start dying are the ones that suffer the most. Those like Taiwan, South Korea, that get out in front of things because their cultural story tells them to do that, are the ones that fare the best. And I think there's lessons in here going forward.
I have two quick points to pile on to that, Bill. The first is that this week the temperature in the Arctic was 41 degrees Fahrenheit above normal. Yeah. And there were, I think last I saw, 1,500 spontaneous fires in Siberia, and it's not even summer yet. Right. And the second thing is that yesterday WHO released its sort of strategic vision of where we might be at the end of this COVID path. And they call it the green vision. And they basically call for the response to COVID to also be a response to climate change with the planetary health focus, that we will somehow take both issues off together. That's the first time I'd seen WHO go beyond rhetoric in any way related to climate change. It was pretty striking.
I think you're muted, Andy.
Thank you. On my own, it's hard being your own producer. Bob, the one thing I learned in 35 years of writing about climate change is, while the headlines are simple, my 1988 article, global warming, the globe is warming, right? Mm-hmm. That's actually, it's like 10 different stories. It's the story of China's coal demand. It's the story of undue exposure of the most vulnerable. I've been tweeting lately. We did a series in 2007, The Climate Divide, in the New York Times, on the fundamental reality that if you're rich and technologically able, you can turn wind into water, as Perth, Australia was doing at that time. And if you're poor, you can't do that. So it's really so many different stories. And, as Bill has to do and you have to do, and the ultimate distillation medium, what's the way forward on this?
Well, I'll start with what I wrote about this week, which was started as an email from a woman in Sweden to this program about how Sweden took a different path. They didn't close down restaurants, and they didn't close down daycare centers or schools, and they now have one of the highest death rates in the world. And 88% of them, the deaths are in elderly people, which is another vulnerable group. And it turns out that they have a really horrible record in many parts of Sweden about how they treat older people in nursing homes, because as opposed to having a great national health service, the nursing homes are left to municipalities, which often can contract them out to private companies, and we all know where that leads. But after I wrote that, and I was very happy with the article, and because it showed that people, for the price of being able to go out for a beer and herring and have their children in school, they were they were killing their older people in nursing homes. But then yesterday at the same time, an excellent investigative article appeared in Forbes by two people that showed that in the United States, 42% of deaths, not cases, but deaths, have been traced to people who lived in nursing homes. And that's astounding when you think about it, 42%. Now, of course, deaths is not everything. A lot of people get very sick and suffer long-term consequences from COVID. But talk about a vulnerable population. And in Sweden, the nurses have come forward and said that they had orders for people who were 65 and over, not even to send them to the hospital for any kind of treatment, just let them die in the nursing home. And so this virus, like as did HIV and so many other things, revealing the vulnerabilities that certain aspects of certain people in our society suffer to such great extent. And but to get back to that, 42% of the deaths talk about, and we're not even testing in nursing homes as much as we should, and we don't even know what testing means. There's never, everybody talks about testing, but I have never seen, and all of us journalists could do this any very time soon. What is a good test? What does a test mean? Do people understand what a test means? There's three kinds of tests, and made by dozens of companies with enormous amounts of variation in the accuracy, and it's leading to all kinds of really serious problems in terms of how we approach this in this country. It's just part of, again, of this massive confusion. And one of the other things, I posted to you, we put out, Andy, there was a webcast or Zoomcast from the Minneapolis Fed last week, and it goes on for 3 hours, and I don't think anybody's going to watch it. But it had Peggy Hamburg, the former FDA commissioner and New York City Health Commissioner. It had Mike Osgood from the University of Minnesota, and Tom Brokaw moderated. It had Julie Gerberding from who's now at Merck, who is head of the CDC. But the most important part, if you watch any of that, go to about 2 hours and listen to Larry Summers, the former Secretary and President of Harvard. And he is, a lot of people don't like him because he's one of the smartest people in the room, and he always lets you know that he's the smartest person in the room. But beyond that, he says, this is so astoundingly devastating to our country and our economy that if we're spending $30 billion to rescue the airlines, and we're spending practically nothing compared to that on research and development of vaccines, and we're going to have such severe consequences from that. He says it well, and I highly recommend it.
Yeah, I'll leave this up and I'll tweet the link out as well.
And I want to build on something Bob's saying.
And
to what Bob was saying, I think that and also what Laurie was saying, I think that what infectious diseases do is they expose existing narratives. And the existing narratives we have about whether it's minority groups or, in the case of HIV, marginalized gay men or whatever it is, those existing narratives come front and center. And so we see these kind of shocking things that most of us who are paying attention knew those narratives, but the public at large didn't. And this virus is exposing all these narratives that are kind of subterranean. And they come flying out at you. You know, the fact that we have inequity between people of different skin colors. And then, you know, you map on top of that the George Floyd thing. It is additive. It is this. It is connected to this. It's not separate. And, you know, I've been finding... Yeah, go ahead, Rick.
I was just going to say the most extreme example of bringing all the narratives together at once, as you're saying, was I was reading the Hindustan Times coverage of the cyclone that came out of the Bay of Bengal and slammed the Bengali region of India and Bangladesh. And it had a long interview with a particular Bangladeshi villager who said, well, first the COVID was here, and I was afraid, and my family was afraid to go into a shelter because we didn't have masks and we didn't want to be with other people that might infect us. But then the tigers came and they ate my cousin and they ate my father. And then our house was knocked down. And then we lost all our crops because salt water surged out of the ocean and flooded our low floodplain, right? Climate change. And now here I am, half my family is dead. There's an epidemic. We have no food. We have no idea what to do or even how we will be alive tomorrow. I thought, wow, it's all there, one package. And it just couldn't be more profound.
Yeah, and that those multiple factors, especially affecting people who have the least capacity again, whether they're in rural Bangladesh or easternmost India on the coast.
And that also, as we get into hurricane season, let me jump in on that. I was watching Bertha this week, which, downgraded to a depression there, but the poor emergency managers across this country who are already running on fumes. Think about now, if you had to evacuate a community in 10 buses, do you need 30 buses now? Are you gonna be taking temperatures outside of FEMA shelters? It completely changes the metrics for disaster preparedness.
Yeah, and we had a session on that recently, and another one is coming. Climate Central did a fantastic primer for journalists on how to think about reporting in the coming months on those issues, and they had on emergency managers and journalists. The emergency managers were from IAEM, which is like the International Association of Emergency Managers, and the points they were making about wildfire risk and flood risk were so granular and interesting. Like a guy from somewhere out west was saying that you look at the demographics of firefighting teams, the leadership are all way too vulnerable to put anywhere near a region with coronavirus. They're all, they're in their 50s. They're all going to be exposed to high levels of PM 2.5 and the virus. So it's even at that level of like who leads the teams doing the firefighting, you end up with this kind of these factors. They're not as dramatic, perhaps, as tigers. I hadn't heard about that tiger incident. That's horrific. But, these factors are going to just play out. And I want to swing things back right to the beginning when Laurie was talking about how the new science revealed how wrong we were initially in perception of the phenomenon and how governments were making bad decisions. The other field I've had on here now repeatedly is these folks in what's called decision-making in deep uncertainty. In other words, you can plan, you can create a landscape of decision-making that can work amid deep uncertainty, where you're not just trying to wait for data, thinking it's going to magically emerge, or fantastically invent policies without data, where you actually act in the face of deep uncertainty, and you have the capacity to shift your practices and shift with agility toward a new thing like tigers or whatever. And that seems, but all of our media, again, whether it's our media or even our decision-making process, even like I had on Rod Schoonover, who's a National Intelligence Council veteran, and Alice Hill, same thing, National Security Council. And they said, even within their decision-making process, you end up with this, they said pandemic was there, but it was on page 29, page 21, actually, Rod said. So it's like, is there a way to normalize decision-making and the way the media can not just wait for the new fact or the new paper and convey things to do now based on the uncertainty, like embracing the uncertainty and the complexity? I don't know. If you all have an idea, I'm happy to hear it.
I think it's a difficult situation, but we're particularly in this at a time right now where almost every family in America is making its own decision, or every individual is making his or her own decision about what is safe and what's not, because of the total lack of guidance from officials at every level of government, especially at the top, and so one of the themes that emerged this weekend at that podcast or Zoomcast that I mentioned to you was that it doesn't matter whether you open someplace up. It matters whether people go there in terms of economics. And there's been a lot of data already from cell phone data that people are not going to places that are opened up. Some are dying to do it, but others are not. And it is not, you open up a restaurant and say people have to sit 6 feet apart. The restaurant, that's not a model that most restaurants can sustain anyway. And on top of that, a whole lot of people are saying, well, it's not worth it to me to take that risk for myself or my family to go in there, and they're not going to do it. But we're leaving a lot of stuff up to individual people to trust whom they trust, without there being any kind of centralized authority. It is utterly astounding. The CDC for years, and we've talked repeatedly about how the CDC was totally marginalized in this for all of the political reasons. But the CDC has this gigantic amount of information called CERT, Communication Emergency Response. And there are ways to do it. There's ways to convey uncertainty. There's ways to convey empathy, which we certainly haven't had from the top here. There's ways to tell people, stay tuned. We'll tell you what we know as soon as we know it. And there's an enormous amount of research in psychology that shows that makes people feel a whole lot better. And I think that a whole lot of the tension that we're feeling right now is just not the danger of this virus, but it's this, as I've said before, this cognitive dissonance that everybody is getting because there is no reliable source. You're on your own. It's like telling a 40-year-old woman, well, talk to your doctor and you decide whether you should get a mammogram. No, that's not what people want to hear. They want to hear, here's what the experts think is the best way to do it. And right now, maybe we don't know, but we're working on knowing, and we'll let you know as soon as we do. But we're not getting any of that from anywhere.
One of the most dramatic risk-benefit dilemmas is a clinical trial. And those of us who write about clinical trials, we understand these complex ideas of how do you weigh risk-benefit. Most people in the public live on this weird scale of hope and hype that is not really that sophisticated about weighing risk and benefit. People wear seatbelts because it's a law, not because they believe seatbelts are great. And that to me is the big struggle, especially since we're looking for a biomedical solution here. And that requires buying into the clinical trial idea of risk versus benefit and understanding that, hey, hydroxychloroquine may well kill you. That's hard for people to accept because they want a quick answer. They want certainty. And we've said this, we've talked about this a lot. That is the underlying problem with COVID-19. There is almost no certainty. You can't have it. It's all risk benefit.
But I think we need to make a separation here because there's the uncertainty and risk assessment made by the average citizen. And there's uncertainty and risk assessment made by policymakers and people in power that affect the lives of average citizens. And I mean, all my years at the Council on Foreign Relations, all my time dealing with national security issues, you always are making policy decisions in the absence of 100% information and certainty. You have to. If you wait for certainty, it's too late to act. And you know that. You don't wait for Chinese troops to march into Hong Kong. Now that they have passed, the CCP's passed their resolution saying Hong Kong shall now abide by the laws of Beijing, and we're voiding democracy in Hong Kong, then action from the rest of the world cannot wait for the tanks to roll in. And the same is true with any outbreak and any climate-related event. You know, if every mayor waited for absolute certainty that a Cat 5 hurricane was going to hit City Hall, then a whole lot of people would die, right? You don't wait for the certainty, the 100%. I think the problem we're facing right now is that we have a government that is making data fudge pre-decided policy. In other words, it's very reminiscent of the yellow cake uranium claims that led us to justify calling for the United Nations to back invasion of Iraq in 2003. And it was, we've fudged false intelligence, and we're now telling you that Saddam Hussein has these nuclear capacities. And I feel like a lot of what's going on with COVID policy right now is fudged data or no data at all. Hey, I take hydroxychloroquine, and you might try some disinfectant while you're at it. I mean, we're getting advice from the top that is threat assessment and risk assessment and policy advice that has a complete absence of actual data. So we've gone all the way to the extreme from the public may want 100% certainty before they want money spent versus we have no certainty at all. We're just making it up, but here's the policy, folks.
It's astounding. So Wendy, if we could have one more thought from Wendy, and then Alexis Madrigal from The Atlantic and COVID-19 tracking project is in the green room waiting to come on, which would be great.
So I just wanted to ask all of you a question. It seems to me that somebody else who's having to make decisions in the absence of information are the journalists. I watched most of the night last night, and this morning a CNN reporter and a cameraman was arrested. Mind you, they didn't arrest the 4 policemen, but they arrested an African-American reporter, a reporter of color. And I watched Ali Velshi walking around last night. I was switching between the two on MSNBC. I mean, people coming right up to him, right in his face and yelling at him. And they had people around them that seemed to be security guards. But still, reporters are putting themselves, and news organizations are making decisions about putting reporters into situations where social distancing is not possible and where people are, as we've all just talked about, angry and frustrated. So how do you all feel as reporters who may be asked to go into a situation like that to cover whether it's riots in Minnesota or, as you have done, Bill, all over the world, where you might not, can you say no to an assignment because you think it's too dangerous?
Oh, sure. Yeah, I think most news organizations would give you that sense, give you that right if it's not there. I was just asked, I just had a baby a few weeks ago, and so they wanted to know that I'm ready to go cover hurricanes if they pop up. And so, yeah, we sort of get our own personal choice on that. But there was a time early on in the Trump presidency when things were getting so heated rallies that we were advised not to wear the logo out while covering. That cuts both ways, though, too. You know, I was down covering this community, Ile de Jean Charles, Louisiana. That's one of the first bands of climate refugees because their island is sinking. And we, on the way down there, got stuck in the mud in front of this guy's yard, deep in the bayou. And, you know, we're thinking, oh, no, we're in trouble. And the guy who came to help pull us out, instead of being a Fox News critic, turned out to be a rabid CNN fan. So you never really know. But that's the thing that is so troubling about this age now that we've gotten into, where if you see wearing a mask as virtue signaling, I can pretty much guess where you get your news.
Yeah.
And it's so vital. I mean, you know, as we've found covering natural disasters, after food, water, and shelter, information is the next vital resource. And if we have a third of the country who believes only the president, and a third of the country that believes only the press, and then somewhere in the middle are people making up their minds ad hoc, how do we get through? How do we create a polio vaccine the way that Salk did and the country did? How do we go to the moon? How do we beat the Nazis if you know, 35% of the countries don't believe Nazis are a hoax? You know, these are the very troubling, but it'll be interesting to see, especially now that we're talking about literal flames in the streets of American cities, and Oscar Jimenez getting arrested this morning. I've never seen anything like that. I mean, all of my colleagues, we've been covering war zones and third world uprisings, and this is the first time I've seen one of my colleagues get handcuffed during a live shot in the United States. Very troubling.
Yeah. I actually did a whole tweet thread about it this morning because I've been in war zones, I've been in epidemics, I've been in natural disasters where angry drunks were roving the streets with guns in their hands. I've been in demonstrations, riots. I have never, ever seen reporters behaving so politely, asking such judicious questions, being treated that way. And that he was basically jumped from behind. That it was a team of cops who came from behind his back that suddenly are grabbing him and handcuffing him. It was unbelievable. It goes so far out of the bounds that you really ask, what the heck's happening to the First Amendment? It was shocking, really shocking.
I'd like to swing back, and you know where this goes from here has a lot to do with.
Oh, can I say something before you do?
Yeah,
Alexis. Speaking of shocking, layoffs at the Atlantic, cutbacks. I mean, all across journalism, we're seeing the money disappear when we need it the most. But my heart goes out to you and all your colleagues at the Atlantic.
Appreciate that.
Amen.
yeah. Even as the Atlantic was doing the right thing of opening its content, like the Times and others, free for the COVID-19 content. So, Alexis Madrigal, you've been covering the world of technology, and we first interacted around energy, I think, a long time ago. And you dove in a very creative way. One of the things I think the media, one of the things I've seen the media do, that is the way to build that trust and engagement with communities, is to go beyond just storytelling, to become curators of data and the like. And so, could you just briefly summarize how you moved to fill that data gap around this virus when it was first coming out?
Yeah, sure. You know, for those who haven't been following the project, what we do is we basically compile data from the states. That's sort of been the core methodology. There's a lot sort of grafted on top of that, and outreach with states and other kinds of stakeholders here. But the core operation is we have human data ingestion that goes through state health departments and territorial health departments and pulls in what they post. The reason we started doing that is actually kind of an amazing story, just for the coincidence of it. My reporting partner at the Atlantic, Rob Meyer, and I were covering COVID in the early days. Ed Yong, who some people may know, was actually on book leave while the pandemic hit. So we all were kind of pitching in because we were like, well, we've got this great pandemic reporter. On the other hand, he's not here. So we had to kind of jump in. And Rob, I should give all credit to Rob. He basically zeroed in on this really key number, which was we just didn't know how many people had been tested. So people were talking about, well, you know, there's not very many cases in the US and this and that and the other thing. But when we really started to look more deeply into what had happened during the month of February and early March, we realized that just the testing numbers were extremely low. And so we went through all the state health departments. We built this spreadsheet. And we published a story on March 6th saying, you know, less than 2,000 people had been tested in the United States to that point, fewer than 2,000 for the copy desk. But at that moment, basically, you know, 20 minutes after we published the story, I got an email from an old friend of mine named Jeff Hammerbacher, who was kind of actually truly a math genius from rural Indiana, who then went to Harvard with me as an undergrad and went to Facebook early, built a data structure for Facebook, and then basically got out of that world and went into bioinformatics. And it turned out that he had been building the exact same spreadsheet. So we decided, you know, we'd known each other for, 18 years. We were like, well, we'll just join forces and we'll keep doing this for a few days until the CDC brings on, you know, kind of state level testing data for people to look at. You know, we were looking at other countries, you know, and they had the information was just available for their for citizens and residents to look at so they could make better decisions. And so we thought maybe we'd be doing it for a week. We literally haven't stopped running those data runs since March 6th. It's just, I feel like a work Rumpelstiltskin. You know, we basically went to work back then, and I wake up now and it's June and we're still doing the same thing. We've added other things. We don't just do testing. We now do hospitalizations, and we collect data on what is known, at least, about the race and ethnicity of people who've been infected and died. But it's a really unusual spot to find ourselves in. You know, the CDC, is an agency that I've long admired. You read books about the CDC. It's clearly been not just a leader within governmental agencies within the United States, but globally. And, it's not like it hasn't made mistakes. And, there've been things that have happened in the course of the CDC. It's not a perfect governmental agency. But it just was incredibly surprising, I think, both to us and to other people, how little information was coming out of the CDC, particularly once testing had been identified as like a key failing. And if there's one thing, I was listening to the conversation before I came on, if there's one thing that was extremely surprising to me about the pandemic preparedness plans that I saw going into this work, was that testing basically was not considered in very many of these plans. If you look at like King counties, which I'm familiar with because of the early outbreak in Seattle, there were like 7 pages of that pandemic preparedness plan dedicated to testing birds, and like a few one-off sentences dedicated to testing people, and even fewer words dedicated to, well, what are the data flows of this thing going to be? And I think that it has turned out that those data flows were clearly not prepared for a situation like this. They've been trying to modernize for a very long time the way that diseases have been reported and the way that these surveillance systems work, but they weren't ready when this pandemic hit. And I think that's how we ended up stepping into it. And it's not ideal. I mean, the CDC should be doing everything we do and a lot more. And a lot of that also falls on the state health officials who are in a very tough spot as well.
With that in mind,
Alexis,
I want to bring Wendy back in too. So hold on one second, because she's been in that universe at the other end of the pipeline. So hold on one second.
Sure.
And I'm showing Jay Rosen at NYU, and I had a conversation about the civic emergency we face, and he feels journalism needs to go into emergency mode, but on other fronts. But the one thing I said to him, so what's the story? And he said, story number one is testing. This is in one of our earlier, it's like the story. And this week I did a second session on wastewater testing as a way to fill in some of the gaps. But does that feel right? Is at the federal level, is that the story?
Yeah, I mean, I think it has been. I mean, I think, for me, the other story is the disparate impacts that the virus is having, and not just important for the communities themselves, which of course is extremely important. I'm Mexican, and the numbers that are coming out in the Latin community are pretty horrifying. Although there's some interesting things about how few of us have died, but relative to the number of infections in the community, maybe an age structure effect. It's like there's a lot of things to explore, but there are clearly disparate impacts right now. And for me, it's important in sort of this next wave, the current moment that we're in of the outbreak. It seems to me that in some communities, you're going to see, composed largely of, essential workers and people who can't work from home, who are, again, going to be disproportionately people of color and immigrants. And you have a situation where you need to understand what's happening with those communities and protect those communities to protect everybody. And that could go in some ugly directions, I think. And so it's really important to both understand and properly frame the data that's coming out about the racial and ethnic disparities within this. That's story 1A for me.
Yeah. So Wendy, from the standpoint of the bureaucracy, not that I don't want to frame you as a bureaucrat, but you lived within that part of the ecosystem for so long. How much of a failure has it been that the CDC hasn't had this agility to be able to ingest data, turn it around? I assume the infrastructure and capacity for that is not just about a Trump time, although it's clear what he's done in his time.
I think what's different now is the degree to which what data exists is being politicized and being massaged. But before that, I do think it's also a funding issue. CDC has always struggled to get its fair share of even the health budget through HHS. NIH has been a lot more successful. There's a million reasons why that's probably true compared to public health programs. And I do think that even the funding currently of where resources have gone for not just the tests, but for all the other equipment that has been made available, even that has been political of what states got it. And there was just a story about how the feds have kind of botched the distribution of remdesivir, that it's gone to the wrong hospitals, it's gone into places that didn't have the necessary refrigeration. I don't have a simple answer for it. I do think that we have a certain lack of public health literacy. I think people understand.
Andy, first of all, I want to say, I've never met Alexis, but I want to say that what you people did is an example of a future of journalism, despite the unfortunate hits you've taken financially. The idea of creating your own data in the face of the lack of it from the proper authorities is just a stellar example of good reporting. I want to thank you and all your colleagues for it. And I put up again, because it's a second example of the article I mentioned before, where some Forbes reporters looked at the number of people who in the United States who died from COVID who had been associated with a nursing home. And they did that in very much the same way. The CDC hadn't looked at this. The states hadn't looked at it. They had to put it together themselves. And when I went back to a bunch of epidemiologists whom I trust a lot, and I said, could this be true? This is really astounding. And they all said, oh my goodness, that looks like it is true. We hadn't even thought of it. So thank you for data. And I think data reporting has a bright future if somebody can pay for it.
Right. That's been one thing that I've thought about through this is just the way that so many, when I was getting into journalism, 13 years ago, there was so much excitement about data journalism and the way, data viz and how all these things were going to change the way that we did a lot of reporting. And, in some cases that has worked out. There has been, the Times obviously does great data journalism. ProPublica has some, big, important ways in which they've been able to pull this off. But in a lot of ways, it felt like that wave had passed in an interesting way because you kind of couldn't get consistent. I mean, the truth is you couldn't build a business model around those data journalism desks, and a lot of them basically went away. And I think what this outbreak has shown is that the journalistic toolkit, which is not just being able to gather the data, but also be able to do the storytelling around the data, provide the context for what's missing, our sort of sense of how to provide transparency about what we know and don't know, just all the different kind of tools of journalism married with a data set that people really want and need has turned out to be pretty powerful. I still think there's, we've been able to get some foundation funding to sort of stabilize our volunteer base and turn some of those people into contributors. There still is no way for the Atlantic to make money on it, and probably shouldn't in this case. But in some other form, it's hard to imagine basically being able to build a workforce to do this in any kind of for-profit way. And maybe that's not necessary. Maybe you can just do this piece of things with foundation dollars and use them to fund some of these things.
The other model, though, and I'm not sure how much of this is related to your tracking project, is where academia and journalism get together. The Jeff Shaman's work at Columbia was the underpinning of this big New York Times package I'm showing folks right now on and also on this idea that there's higher death counts and the like. So what's the potential for academia to, even, by the way, academia is going through a fiscal emergency as well as this model. So, all of this is uncertain terrain. But one of the reasons I'm at Columbia is because there's ways to do those kinds of intersectional innovations that I haven't seen, in the journalism operations I've been at on their own.
Mm-hmm. A lot of data-driven stories, and I take my hat off too to what you've been doing, Alexis. They're incredibly time-consuming. Mm-hmm. They're hard to get right. And it's incredibly easy to make mistakes. Yeah. And you also depend on a graphics department that has to be working hand in glove with you, and that's a very expensive endeavor. And when we do data-driven projects at Science, we're very careful about diving in. I look for data sets that pre-exist, that I don't have to collect the way you're doing that. Yeah. That's the ideal way to do it, that are already somehow cleaned up. And then I work with academics very closely. I just did this about seasonality of disease, where I looked through New York. There's a public database for all the states in the country, and that has tracked for decades when different diseases peak. And I worked very closely with some Columbia University researchers to comb through it, because it just wasn't that clean. You saw some really weird things when you started. So I applaud what you're doing. It's an enormous effort. I want to backtrack just for a second to this testing question, because I think one of the most stunning Trumpisms that's occurred is Donald Trump saying that we inherited a bad test. To anyone who's a thinking person, it doesn't make any sense. Because how can you inherit a test for a virus that no one knew existed, right? It's illogical. You could not, there's no way, but that concept that we should have had a test at the ready, I think builds out of influenza. And if you look back to pandemic H1N1, which surfaced in 2009, very rapidly we had a test all over the country for that, because we knew how to make wide-scale influenza testing. I mean, Laurie knows this, Bob knows this, Wendy knows this. We had a system for influenza testing, and we were basically just plugging in a new antigen. But we had no system for wide-scale coronavirus testing. It didn't exist. Mm-hmm. So this notion of, I inherited a bad test, I think grows out of this notion, and why pandemic plans, which are all skewed toward influenza, by the way.
Yep.
Our whole preparedness came out, I mean, the vast majority of money was about biodefense. And pandemic influenza was locked on top of that. And emerging infectious diseases weren't even part of it. They weren't part of the discussion. It was about protecting ourselves from anthrax and, hey, there might be pandemic influenza. But anything else was just kind of like...
So how much of that, I mean, Alex...
If I could just add...
Sorry, yeah.
I was just going to add to that on the other hand, we're going to really, really need influenza testing in a couple of months, because we're going to have COVID on top of flu. And every single physician is going to need to know, am I looking at a flu case or am I looking at a COVID case? And differential diagnosis isn't always going to work. Right. And so given how bad a lot of the COVID tests are, I think we're going to be needing influenza test kits like never before.
Well, I wanted to ask Alexis about Silicon Valley and the broader landscape of tech innovation, CRISPR. Tara O'Toole, this was a Council on Foreign Relations briefing like way back in March, was talking about what we need more is the capacity to generate tests. It's not so much did we have a test on hand or not, it's what is our capacity to be rapid, to be agile, to have the industrial, academic, governmental landscape that can come together and create tracks that rapidly get us to where we need to go when, as Laurie was saying, we're going to have these multiple risk factors. So you must be immersed in that. I'm on these daily lists of the SciFu folks, and they're, it should be more than a SciFu listserv. So what's going on there?
Yeah, I mean, I guess the things that I'm most looking at, just because I feel like other people have, some of the emerging ways of doing this testing on the science side. I've been thinking a lot about the kind of more logistical side, and how you actually get people to take these tests. So there's kind of three interrelated things I've been thinking about. One is these sort of pooled assays where you test a group of people at a time, and you try and basically create the largest group where no one will test positive. And so there's economists working on that. There's public health people working on that. Sort of how you can basically test a much larger number of people with the same amount of chemicals.
HIV for years, by the way. It's been done in HIV for years, pooled testing.
Yes, exactly. Done in HIV. It's a standard in veterinary diagnostics, from what I hear. So it seems like something that's very possible to do, particularly if you kind of pair it up with some of this employer-based testing. I mean, I know for a fact that this is something that the meatpacking plants are beginning to explore, and you need to change. I don't think you're going to be swabbing people every morning, so you're going to need to do the saliva-based tests, and there need to be some other changes. So one of the big ones that I've been thinking about is, you need people to want to get tested. And we've focused a lot on the supply of testing, rightly so, because you kind of you need the capacity, but there's sort of this broader set of factors, which are, you need communities to feel like they can trust the healthcare system. You need like the actual my son got swabbed. It is a miserable experience to do with a kid. I mean, really, really miserable. And, you've got to make it easier, cheaper, and more accessible in all of those ways. So in a lot of ways, maybe that's a boring answer. It's certainly not a very science forward answer. Definitely not a science foo answer, but it's like sort of the boring parts of this testing logistics and the boring parts of sort of making this easy, making this something people will just do because it's cheap, it's available, and they don't have to worry about pain for themselves or their children. Or their parents, those are the kind of things that I've been thinking a lot of, particularly if we're talking about, some of the numbers people have thrown around of the number of tests per day are just really tremendously high. And so you're going to have people being tested a lot. And I
think we have to jump on top of that and realize that if we're already suffering shortages of reagents, of PCR devices, of swabs, and so on and so forth, that's peanuts compared to what happens when all this escalates to global scale to where it needs to be for every country on the planet, in which case nobody has enough of anything. So it's very much, I see it very similar to the problem with appropriate vaccine development. It's all about where do you set the bar as the challenge to industry to begin with. If the bar is set, just make something that, an MD can do, and it can be hauled off to a laboratory and 1 or 2 days of processing, and then the results can be given back to the MD, who then conveys them to the patient. If that's where the bar is set, then we have crap, and it's useless, and it doesn't translate into a global model at all. So the same with vaccine. If the bar is set, we can use mRNA. It has to be stored on dry ice. It's really difficult to make. It can't be transported around the world. You certainly can't get into hot tropical zones with it. Ha 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 ha. If that's where the bar is, then we have a failure. So I feel like with the whole question of testing, point of care testing or point of intersection testing is the only way to go. And the results have to be available immediately. It's a matter of minutes. And it cannot require machinery. It cannot require, any sort of refrigeration. It has to be instantaneous. And that's why I think there was a huge amount of enthusiasm back in early February, when the New York Academy of Sciences had a big CRISPR meeting, and Feng was there from MIT, and he presented the latest on their CRISPR-based paper assay that would be akin to a litmus test. It would change color. Right. Yes, no, it's a piece of paper. And now we know that none of the CRISPR-based assays have been able to get bankrolled and get moving in any reasonable way, even though it looks like they work.
That was Tara O'Toole's point a month or so ago too. That's under focus. It's just not focused on as part of this the menu of what you want to build right now to get forward. We have to kind of wrap this up. We're past 2:00. And I would like you all to kind of think about the next story. I think you've identified it in some ways. The two, the imbalances are clearly a story that's got to keep developing. The ethical stories around that, the scale story over and over and over again comes at me. Same thing with climate change. Don't tell me about a gigaton. Don't tell me about a megaton of avoided CO2. Tell me about gigatons, and then I'll write about you. And here too. And that's why I focused increasingly on wastewater as a proxy, at least at the community scale, for an early warning system that could direct more of the attention. And you could have, the wastewater from a meatpacking plant can be monitored as an aggregator. So what's, just quickly around the clock here, and Robert Bazell has stepped kindly back into the green room. So we have our 6 windows. What's your sense of the story as we head into the summer, the first COVID-19 summer? And then we can reconvene next Friday, of course.
I'll go first because I got to run.
Yeah, thank you again.
Yeah, it gets perfectly encapsulated by me being in the crossfire between 2 different institutions inside of the University of Washington, because I tweeted that a University of Washington paper had shown that we're going to have 215,000 dead Americans by sometime in September, and that we're not going to go into waves, but rather a continued steady state that just shifts geographically around the United States, but the same daily new case and death rate all the way through to September. And I tweeted that a University of Washington study showed this, and immediately got deluged with very angry stuff from the International Health Metrics and Evaluation Group, a rival group that doesn't agree with the prior group, saying, oh, that's not what our analysis shows. We show it's all going to peter out in July, and we're going to have this long hiatus, and then we'll have a second wave that will suddenly surge. I think sorting this out and understanding what the definitely premature reopenings have meant, what kind of kindling has been thrown on the fire, and whether or not that means we're going to continue to burn at the same rate all the way through the summer, or are we going to see the fires start dying out all across America? I think that's a pretty fundamental question, and one that we need to have a lot more data to inform over the coming 3 or 4 weeks.
So, Alexis, are you stuck scrambling to get more data, and what you're thinking about story-wise?
Yeah, I mean, story-wise, I'll piggyback on Ed Young from our team's patchwork pandemic idea. This is kind of how it looks to me in the data. Right now you have the South with increasing cases, and you have the West with some increasing cases, and in the Northeast you've had things come down a lot. There's 4 states though that are hitting just peaks for hospitalization just right now. So Minnesota, Wisconsin, Arizona, and North Carolina. So you kind of have this really interesting pattern that's developing where on a national level, things do look like they're bumping along, but on a local level, you are seeing these flare-ups. I think the big question for me is, and this is a question of my own decision-making, but I think it's mirrored in many people across the country, is, all right, so things are opening up. We're also just tired. We've been 10 weeks with our kids and everybody else. So you start doing a few more things. What are your thresholds for pulling back? When do you say to yourself, okay, actually we're not gonna go on hikes in the crowded park. We're gonna go, just all the little decisions that people are having to make. I would like if there were clear guidance on what those things were. I would like if I could trust that the data that was coming out of the county health department was going to be reliable and relatively up to date, and that we would know if there was an outbreak that was taking off. I'm still not totally sure that that's going to be the case, although I'm slightly more optimistic about that than I was 10 weeks ago, that we would know what's going on. That's a pretty low bar. Yeah, I mean, a lot of that comes back to testing. A lot of that comes back to data reporting. A lot of that comes back to increasing the speed of all those little steps so that, it's easier to connect decision with consequence. For me, I think the continuing long story that what I just said is a piece of is just how far apart decisions and consequences really seem to be within this pandemic, and how hard that makes it both for well-meaning decision makers, but how much cover that also provides for people who maybe don't have the public's best interest at heart, because they make a decision, nothing immediately shows up in the data. Maybe it will later down the line. Our citizens going to be able to connect those things together, and I find that to be quite like a troubling informational situation.
And John, at Science Magazine, where do we go from here? Just, we can't think about the grand solution scale yet. So we're still in chapter 2 of a long book.
Yeah, well, the question that Alexis is raising, if you look at California, you already see a couple of counties shutting down after opening up. You do get clues from other places. You have to keep looking to your right and to your left to learn. And look at what Wuhan's doing now. They're ramping up testing. They just tested in 10 days, 11 million people. And that's a place that shut down spread. So I think we have to start thinking more along the lines of what others are doing that's working. And for me, scientifically, the great question is a vaccine and the vaccine race. And it's getting more and more interesting every single day. And it's our great hope, in addition to treatments that could prove themselves over the summer. And so I've got my ear to the ground on that. And it's a fascinating scientific dilemma, trying to move this quickly with this many players. And the scientific issues are coming to the fore, as I expected they would, as we've seen with Moderna being slapped down for a press release that hyped, as we've seen with questions about financing and who's running Warp Speed and what are their investments. I mean, all of these really critical questions about vaccines are now coming out in the open. And that's only going to intensify, because our desire for a vaccine, our belief that that's our best way out, is the center, to me, of the biomedical solution. And I think there's great interest in it for good reason.
And and then of course there's the will they take it. It's kind of like the 3 days of the Condor line at the end of the film. It says, will they print it? But I think, as John, you brought up that all it takes 70%.
Yeah, the polio story, where 70% efficacious vaccine that went to 70% of the people in 6 years, from 1955 to 61, before the oral polio vaccine is even introduced, reduced the incidence of polio 96%. We don't need everyone to take this vaccine. I hope we have that problem. There's a lot of hand-wringing about it, but give me that problem, please.
One thing at a time. And Bob Bazell, your last word here and what you're thinking about going forward.
Well, one of the things we keep seeing is these waves of false hope that are generated by politicians for political reasons and people on Wall Street because they want to run up a stock. And it just seems so bizarre, because nobody knows whether they're safe. And the politicization of wearing a mask, which emerged this week, just makes me so frightened about this country. And I hope, John, you're right about vaccines coming soon, but
that's what I said, Bob.
I don't know. That's why you didn't say vaccines are coming soon, but a lot of people that are saying that, and for reasons that have nothing to do with the science that you cover, are showing. There's so many problems out there, and I think I believe in vaccines as strongly as John does it, but it's a three-legged stool. We have to improve vaccines, we have to improve testing, and what's the third one?
Well, governance.
Government. We have to improve.
That's one.
And treatment. We had a truly effective treatment, a truly effective or even partially effective vaccine, and a really good fast test. All of those things would do a lot of things to make people happy. And we keep hearing rumors about this happening, and it causes enormous amounts of changes in people's perceptions. But nothing has happened that I've seen that gives me a great hope of any of those three things are going to happen anytime soon.
So hang on, and this is a long journey. The reporters, Laurie Garrett on here, like 2 months ago, I had her on very at the beginning with an Iranian journalist, and she had a warning for journalists coming new to this beat, saying that, this is harder than war reporting. And I think when you look carefully at how she framed that, it was really a valid point. Hopefully journalists listening here will understand this is a long haul thing. This is not a blip. This is not even 9/11. This is so massively transformational. I want to get the last word from Bill, who was so kind to come on, and congratulations on your recent addition to your family, and to Wendy.
Thank you.
There's one thing I want to be sure that Alexis saw, which was this message from, I think it's John Isham. He says, Alexis, you should connect with Jamie Joyce at Society Library. We should discuss funding needs, and we could request support from corporate VC philanthropy organizations. So write that down.
Yes, thank you.
So Wendy, you want to weigh in on what the average person can be thinking about in this landscape going forward in the next week or so before we reconvene?
So I feel like I'm always Debbie Downer in these conversations, but the thing
after what we just heard.
is, oh well, Bob and I both our families both came from Pittsburgh, and I literally grew up in Mr. Rogers' neighborhood. He lived 2 blocks away from us. Our neighbors were characters on his show. And the one thing Mr. Rogers always said is, when things are bad, look for the helpers. And to me, what's been so scary about the last couple of months is the helpers have disappointed us. The government officials who are supposed to have the data that we don't have. The police, who yesterday did not show their best. The prosecutor, who isn't going to arrest the guy. The guys. The president, who is spending his time attacking the media, attacking private citizens, talking about the only good Democrat is a dead Democrat. I mean, I feel like we need real helpers, and I think that in this current environment, all of you who are reporters who are telling the story are the helpers now, and the most important helpers, who can point out where the people we hoped were our helpers are failing us, and maybe bring more truth and bring some honesty and some reality to where we are. So that's my parting word for the day.
That's a wonderful one. And Bill, closing thought from you too on going forward.
Sure. I want to jump on the praise for Alexis and the Atlantic. And when the president snarkily said it was great news that 20% were being laid off, I mused, I wonder how many new subscriptions it would take based on that tweet to bring those people back. Yeah. So we're rooting for you out there. On the climate side, I'm working on, as my dad used to say, the test of a man is what he does when he thinks no one is watching. And the EPA is definitely not watching these days. And when you tie together that people who live in the dirtiest air are more susceptible to COVID-19, the ramifications of that. So I'm digging into what these some 100 EPA rollbacks are doing to our nation and our planet. And also I'm really interested in the economics of this as we talk about a transition, hopefully tying this to energy. It was solar and wind installers were the 2 fastest growing jobs in the country, but they just took, I think, 300,000 layoffs along. They're suffering as well. And at the same time, renewables for the first time surpassed coal for energy output for 40 days straight. But will it be sort of revenge pollution once these factories can crank back up again, once we can get out of our cooped up cages? So a lot of it together, but ultimately, All of this is a reminder that everything is connected. All of, this is not a climate story or a public health story. It's an economic, political, religious story, and all of those things together. And as journalists, we're in such a precious, I have almost corny reverence for this calling, as Wendy said, that we have to be helpers right now and find the truth. And in the darkest time, certainly in my lifetime, let's go do it.
Let's go do it. That's a good call. And preserve the energy in your own health as you do it, which is a key to long struggles. You can't pursue sustainability unless your own existence is sustainable. And that's one of the challenges. I want to close by saying on Sunday, as always, we will be focused on songs and poetry. A new poet, Indian American poet, is going to be on. And that Sunday is 10:30 to 12:30. I do that as a way to kick back and recharge after the weekday sessions, which are focused on these tougher questions. Next Wednesday, we're doing a session with the amazing social scientist Sheldon Solomon and Simon Dalby on terror management theory, which can be a good thing. It sounds terrifying, but terror management is essentially one of the great human challenges is dealing with our awareness of our own mortality. There's a whole body of science and sociology and philosophy that's built around that. And there's actually positive lessons in that arena for something like COVID-19, terror management theory Wednesday. And then next Friday, we'll be back with whoever from this consortium, this team can come back. And I'm going to be doing a session on the role of art. Separately, I want to show you something in closing. In China, earlier this year, an artist named Wu Gudong did a photographic montage. You're looking at it in close up here, and I'm going to show you what it actually is if you haven't seen it. 3,500 images that were from Wuhan and areas that were in this prolonged shutdown. They did a big social media campaign to get images of people in lockdown, and he created this. It's not exactly a heartening picture, but it's showing a form of engagement with the public through art. That's just as important to me as some of the things we do through data and through science and through journalism. And I close by with a little bit of reading, just very quickly. Sustain What? This thing you're watching and engaged with and hopefully sharing is a global online conversation identifying solutions. Hold on, I just lost my place. Pretty funny. Sustain What is a global online conversation identifying solutions to the complicated, shape-shifting, and epic challenges of humanity's great acceleration and this great pause right now. A prime focus is making sense of and getting the most out of the planet's fast-forward information environment, the one Earth system changing faster than the biogeophysical environment. This webcast is produced as part of my work building Columbia University's new Earth Institute initiative on communication and sustainability. And the daily question is, how do we make information matter? For the time being, these sessions will focus on COVID-19, the societal and economic disruption, and the health questions. But as you already have seen, like last week when we had a session on Amphan, the cyclone. We're dipping into other subjects and solutions as the time is right. So this turns into an archive video immediately on 4 different platforms: LinkedIn, YouTube, Facebook, and Twitter. Via Periscope, please share it. Please suggest ideas for future episodes. And thank you so much to my guests for taking the time to be part of this. And to you all who are watching. Thanks again.
Thanks, Andy.
Thank you.
And Wendy.
Stay healthy. Get some sleep.